Hi, it's Maria Mitchell, and this is my Indwelling catheter or Foley catheter checkoff and lab video. All right, so I have my Laerdal vagina, and I have my kit. We'll just pretend my kit's already in the plastic. And I have an extra set of gloves just in case. All right, so getting started with this video, I will perform hand hygiene, provide my patient with privacy, and as well as greet my patient. I would say, hello, Mrs. So-and-so, how are you doing today? She would say, fine, thank you, how are you? I would say, I'm great, thanks for asking. And then I'll move on and identify and confirm this is my patient to make sure this is the correct patient we are doing the catheter on. I would do that with asking her name and her birthday, and then I would look in the system and confirm that this is the correct patient that needs the indwelling catheter. After that, I would assess her and make sure that she doesn't have any allergies to latex, shellfish, iodine, or chlorhexidine, because those are things that are used in this kit. So just to make sure we don't harm the patient. Next, I would inform her the rationale for inserting or removing the catheter, and as well as I'll be cleaning her perineal area and asking her for verbal consent, which is, I would ask her, is this okay? And she'll say yes. And I'll ask her if she has any questions about the process. She would say no, and we will move on and further on. So I would raise the bed to my hips if we were in a hospital setting. And before we even get started, I would assess my patient. Does she have any bladder distension to see if she's retaining any urine? And so I would look above here. This would be where her bladder is if it was her body. And then after that, I will also assess her perineal area for any redness, breakdown, open sores, or rashes, which I do not note, so we can move on. And next, I will make sure that my patient is supine, which she is, with her knees flexed, and the head of the bed would be lowered to her tolerance, whatever she can tolerate. After that, I would ask my patient if she could move her ankles up and to the side and bring her knees outward. So she's kind of opening up. And then after she's done that correctly, I would perform hand hygiene, and I would lower the rail on the side of the bed that is corresponding with my dominant hand. So I'm right-handed, so I will be on the right side of the bed. Doesn't really matter in this situation because I don't really have a bed. She's right here, so it's fine. So next, I remove my kit from the bag, which I already pre-done. So we'll pretend. And then we do keep the bag and use it as a trash bag. That's what I was told. So I just put my trash bag over in the corner. And then since my bag was already used, it's kind of like open. So I'll just verbalize how I would open it. So when I do open it, I would move it. I would open it away first, and then side, and then toward me. And we'll make sure that's all. Let me just go out the way. Make sure all this. Okay. So then next I would open it. I'm just going to move out the way because this is just a sheet that you would do to isolate it, but this kind of gets in the way of women. So we're just going to put that in our little trash bag. So next I would go to my sterile gloves. It should have been on top. I put my kit together wrong. But we'll pretend they were on top. So open up my sterile gloves. I'm going to move this. We'll just pretend that was already out the way. And then I also know which hand I will be keeping as my sterile hand, which will keep my dominant hand as the sterile hand. And these are a little harder to put on just because they're being reused, so please don't mind me. That'll do it. Put the fingers in the cuff. It don't help that my hands sweat, so they like stick. But okay. All right, sterile gloves on. This can go in our trash area. So now we have our sterile gloves on. We want to warn our patient that we're going to be cleaning her perineal area. And so before we get to cleaning, I know you're supposed to take this sheet and like cover the top of the patient. So we'll just pretend like the top of her body is being covered. Make use of it. And then I'm just going to go ahead and set up my kit. So what I would do is I would take my lube, put it in the little tray, and get rid of this. I just like to set my stuff up early. And then also taking my iodine, spraying it or pouring it all over my cotton balls. And that would be trash. I have my Toms ready. Put that over there. And I would take my sterile saline and we'll remove this tray and put it on the sterile field. And what I'll do is take this and put it, make sure I stay in the sterile field. Put this and lock it in the port so that's ready when it on insertion. And I'll also remove this blue bag off of the catheter and make sure to keep this within the sterile field. And this gets thrown away. So put that back, put our tray back on top. All right, and so we got everything. We got our lube in here. We don't need the specimen because this is if we were getting a specimen, but we're not. We're just indwelling it. So we'll put that in there. So I got my cotton balls covered, I have my applicator, I got my lube. I already got my sterile saline already hooked up to the catheter. So we're ready to clean her and insert. So what we'll do is we already warned our patient that she's going to be clean, or we've been cleaning her perineal area. So what I'll do is move the catheter between, or the catheter tray between her legs. I'm going to take my left hand and I'm kind of going to slide this down so you guys can see what I'm doing. All right, so I'll spread her area open with my left hands. I'm just trying to make sure you can see. Yep. So I spread it open with my left hands, and then in a downward motion, I would take each cotton ball and clean from the top down to the anus, from the middle, the sides, all of it. And I just keep it spread with my hands. And we'll just throw each cotton ball out with each wipe. And I already had used my tongues to make sure they're nice and soaked with the iodine. So I can throw my tongs away if I want, or I can keep it in a tray. Doesn't really matter. Okay, and now that she's clean, I can remove this tray, or have the tray on the side. I just do mine and keep my tray there. And I will take in my dominant hand, I'll leave 1 or 2 inches out wide. I'll do it under my arm so you guys can see. Wide the catheter up, kind of like that. And now I'm able to do it. And I would locate her urethra. And look, it's obvious on here, but in real life, we would have to actually search for it. And I'm going to go ahead and warn my patient that she'll feel some pressure. And I'll ask her to bear down as I insert the catheter. And as I insert it, I kind of inch it in like an inchworm. And then I'll know that I've gotten far enough. Hold on. When I see a flash of urine. And then once I see that flash of urine, I'll insert that extra 2 inches. And then we will be in there. So then once that's done, I feel as if I've gotten there. I'll take that left hand that's been spreading her and hold that catheter. And then with my right sterile hand, I will insert the fluid and inflate that balloon in there. Okay. And then I pull on the catheter gently just to ensure that that balloon's in the right area. And after that, I'll undo this, throw that away, And then I can remove my gloves. I'm going to keep them on for this instance because we're about to remove it. But I would act like my gloves were removed. I would raise the side rail that I had lowered, perform hand hygiene, and put on some new gloves. And then I would put the stat lock on the patient's leg so we can keep the Foley in place. And that way we don't have to worry about her yanking it out or anything when she walks. And then after that, I would put the bag on the lower side of her bed. That way it's below the bladder. And then I would clean and dry her perineal area one more time just to make sure that everything is sterile. And then we'll be good and the Foley will be in place. Okay, so now we are removing the Foley. So I would come in, inform my patient that I'm going to be removing her catheter. And when I begin, I'll remove that stat lock that I put to keep it in place. And then next would be to remove the balloon. And I've already performed hand hygiene and put on my gloves before I even came in the room. Okay, so we'll have an empty syringe. We'll put it back in that port. And we will remove the fluid. And you should get all the fluid that you put back in there. With this being a dummy, you just have to kind of make sure you get it all. All right, so I got all my fluid. It's already in there, so that's back. So you just throw this out because you don't really need it for anything. And so once we know that our balloon is deflated, we'll remove the catheter slowly as our patient is exhaling. So we ask her to exhale, and you remove the catheter slowly. And once our catheter is all the way out, we would observe the catheter for any like blood or mucus or any signs of infection. Once we know that there isn't, we would throw this away, remove our gloves, and then raise the side rail back up, perform hand hygiene, and then make sure our patient bed is low, locked, the call light is in reach, perform hand hygiene again, and we're good.